Hi everyone, and welcome to the second episode of Palliative Care Talks. This is a web series organised by the Palliative Care Voices network, which is a patient, family and carer palliative care advocacy network. And today we're joined by Sacha.
Hi.
Yes. So Sacha is an author of an incredible book, which I've got here, called Follow the Child. Buy it. And I want to kind of describe it as like a Bible for parents going through children's, young people's palliative care, because it's got so much rich information in it. We'll talk about that a bit later. So, Sacha, start off by telling us your story.
Basically, my eldest son was diagnosed with a brain tumour, a cancerous brain tumour in 2007. So he was 11 then, and endless complications from late diagnosis, and which meant loads of extra surgeries. And we had a typical sort of oncology cancer path of, hope. At the beginning we were supposed to be, in the 75% that would have a cure. And then unfortunately, of course, I realized that 25% don't get cured, and someone's child has to be in that 25%. And unfortunately, in 2012, it came back in the May, and he died at home peacefully and with great dignity, in his bed with no regrets about his life, cat on his bed, dog by his side, and the whole bit, in 2012, so when the Olympics were going on, actually. So hard, but it is a huge consolation in my grief that he had such fabulous quality of life up until that inevitable death.
So what was Dee like?
He looked like me, poor child, and he loved science and he loved going to school. So for him, his quality of life was, my job was to make sure that even if he only got to school for an hour a day, just to see his mates at lunchtime in his wheelchair, sometimes in his wheelchair, sometimes from some of the treatments, the cancer treatments, that was pretty much critical to him enjoying himself. So we never pulled out of school, even though there were months and months sometimes when we weren't there. But that's not the point. The mental thing was he was still at school, linked to his mates. Do you know what I mean? Yeah. And he wanted to be a scientist. He was mad about the environment, and he would probably have done sort of environmental science or something like that at university, and he wanted to have had a girlfriend, and unfortunately that didn't happen. But those were his only regrets, that he hadn't managed to get to university, and he just didn't live long enough. He would have got them, if you see what I mean.
Yeah, definitely. Yeah, and I totally understand that. So what were your experiences of services and support around Dee's diagnosis, his treatment, and at end of life? What were your experiences on those?
So we had absolutely fantastic sort of specialised children's cancer services, which is based, our main treatment centre was at Southampton General Hospital, which is it's an hour without traffic, but it can be a lot longer each way with traffic. And then some of the treatment was done at Salisbury District, which is about 45 minutes away, and their nurses would sometimes come to school or home to do injections or take bloods or all the kind of stuff that you have to do. They were completely brilliant. And then, to be honest, at that point, our GP surgery didn't have much contact, because really, it's not the kind of stuff I would occasionally go in about. My daughter, who was only 5 when he got ill, would say, "Are you going to the little doctor or the big doctor?" And she thought everybody was having chemotherapy. If I had a headache, she'd say, "You've got to go to the doctor and have some chemotherapy and it'll make you better." Oh, so sweet. But then at the end of life, our GPs really, really kicked in, because unfortunately at that time, it's changed now, they didn't have a paediatric palliative consultant at Southampton General. And I think now we would have been immediately then linked to the children's hospice that's only 40 minutes from me. And that would have meant we would have got and would have found out about Together for Short Lives, but also hospice home care. So we got none of it. We were never linked. And it also meant that the 2 other children never had any support counselling. We had no bereavement support. And we could have had, the home care would have meant I would have got day support, which, when his dementia got really severe, I mean, he didn't know where he was, who I was by the end. You couldn't leave him for a nanosecond. He didn't know it was day or night. So you were needing 24/7 someone with him. He was up and about and having a good time, whether it was cooking or friends were coming in or whatever. But we could have really done with that. But our GPs, again, it was luck. The GP here was one of only 6 in the country at the time with something called Gold Standards Framework End of Life Care Training. And that linked brilliantly with the multidisciplinary team at Southampton General. So it worked. So I had basically a 24/7 phone line to Southampton General. So I was always on the phone because he was quite unstable, going, should I up the meds? Shouldn't I up the meds? You know, he's doing this. But that's really what I needed. Do you know what I mean? Then the GP, we had a fantastic district nurse who was happy to and qualified enough to nurse Dee Dee. So again, but that again was luck. What would they have done if she hadn't been there? Do you know what I mean? And then Marie Curie, and this is where I became obsessed with planning. And this was how it was presented to me by the palliative care nurse that used to come out of Southampton General, because there was a nurse, but there wasn't a consultant. And she said, oh, because there's a good advanced care plan in place, Marie Curie, who normally won't nurse a child at the end of their life, will come and help a 16-year-old. And I'm very happy that because of the work I've been doing, Marie Curie are now really on board with enabling young people. So 16 and up, if you want to be in your own home and you need Marie Curie, they will help you. So their nurses gave me night support, because I will admit I was absolutely on my knees by the end with exhaustion. And again, if I'd had the hospice link, I wouldn't have been. But hey, we managed it. And he said, I love it here. He was so happy, you know, in terms of, I mean, admittedly, his dementia meant but dementia is an interesting thing though, isn't it? You know, they are themselves, but you lose them. It's quite hard to describe, but his death was really, all his symptoms were under control, which, given how, you know, the pain from the spine, seizures, sickness, all of that was managed absolutely beautifully at home. It was, and I think doctors who hear me go, oh my God, you know, those are dreadful symptoms and dementia. And if I've no medical background whatsoever, none in my family, there's no nurses, I wish there were, but they're like, and I'm like, if I can do it, then, and I was exhausted, anybody can do this with the right support. You just need the right nurse, the right team for your child. That's it. So
exactly. It is about having access to those services.
Exactly. It's exactly that. And it's a huge consolation in grief. I mean, I meet families where the quality of life for their child has been really poor, and they haven't been listened to, and they haven't been linked to services, and then the death has been bad, and they say we will never recover. And I totally believe them. And, you know, unfortunately, you know, parental death after a child death is well documented. If you load all of that onto families and they have regrets, and it's totally unnecessary to do that, you know, just have to listen and make sure, you know, commissioners absolutely are legally bound to put these services in place, and they're just not. So it's hence us talking like we are publicly, yes. Because if we don't create that demand and make sure every single family has the resources that they need, you know, we don't run maternity and go, oh, I'm sorry, you know, you can't have your baby after 5 because there aren't any services around here. You're just going to have to go and have an emergency cesarean, you know? And they managed to link the midwife, you from a hospital midwife to, you know, health visitors in the community. It's like trying to get some leadership and people to get their minds around. It is so much better to have people supported in the community, however they want to do that. There's no one way of doing that, but it has to be planned and it has to be funded. They can't just wing it, which is what some of the commissioners are doing. Do you know what I mean?
Yes, definitely. So, yeah. So you decided to write Follow the Child, that book. You know, obviously, it's, as I said, it's more than just a textbook. It's your story, it's your life and your experiences interwoven with facts and figures and statistics and services. And I really think it's kind of a life-changing book for a lot of people. But obviously, people need to know it's out there. People need to be told it's out there. What motivated you to write that book more than anything?
It wouldn't have occurred to me. I mean, you and I were talking earlier about how hard it is to speak about what's happened to us, whether it's the illness, the treatments, it doesn't really matter when you have really serious on how difficult that is. So you get this feed that people don't want to talk about it. So you think, I need to shut up because they don't want to do this and I have to do this on my own somehow, which I know that is wrong and I'm going to get ill if I try and do it on my own. It's just not possible. But basically the brain tumour charity were getting feedback from their families, and they were saying, you know, at end of life, families are feeding back to us that they feel they have no support, they're totally isolated, you know, they don't have any information. And they said, listen, would you, because I was already their campaigner for early diagnosis for the Head Start campaign, and I'd done a lot of stuff about that because I knew how much it would have helped Dee Dee. You know, he'd have had 10 less brain operations probably. He might even have survived if we'd been early diagnosed. They said, would you talk at one of our patient information days for families about how you manage that end of life care at home? And I was kind of gobsmacked. I thought, oh God, you know, maybe no one's going to want to listen to that. You know, I didn't think anyone would stay in the room. I didn't think I could do it. And I'll admit, I must have cried my heart out for about a month trying to write the speech. But then I'd kind of processed it. I'd looked at the worst bits of it that I'd kind of stuck away somewhere. And actually I realized that it was very helpful to have done that. And then when I gave the speech, the reaction from families was so extraordinary that a father contacted me on Facebook and said, you have completely empowered my wife to think about this in a completely different way. And then when their beautiful daughter died, about 9 months later, they bothered to go back to the charity in their grief and say, please, would you thank Mrs. Langton-Gilks? I honestly, it still makes me start to cry. You know, and I thought, this really needs to be talked about. And then the doctors were saying the same. Would you come and talk to other doctors? Because we want to understand what it's like to be, you know, from your side of the desk, and how you understand the language when we're trying to tell you these really difficult diagnoses. And, you know, we really struggle. Would you help? So I'm like, okay. And then because of that, and that got picked up, I got asked through a psychologist actually on Twitter. She said, you should write a book about this. And I was like, God, you know. And then I realized I couldn't write it on my own. I didn't just want to be, there's too many families out there that are not cancer families like mine. And cancer does get a lot of publicity. And it's the rarity of a lot of the children and young people's conditions, or when they're not diagnosed at all. I had a lot of contact with mothers in hospital like that. And I used to think, we are so lucky to have a diagnosis. You know, but my friends would be like, you can't say that you're lucky that your child's got cancer. I said, when you've met the other families, I have a lot of help. I can say my child has got cancer, and then I can get loads and loads of support groups and help, and they don't have any of that, and it's just wrong. And they are even more isolated than I feel myself to be. So I thought, right, I'll go to Together for Short Lives, see if they think the book's a good idea. And basically asked as many people, as many health professionals for their input, and they put me in touch with the incredible other mums in the book who'd lost children to totally different diseases, so that you could see the different sorts of death, if you like, the sort of different pathways, because they're very different. So, and actually that's been so lovely to get to know them, because of course, you know, like I'm talking to you, I can talk to them about absolutely anything. Do you know what I mean?
Yeah. Was it cathartic writing it?
I think it was. I think doing those first speeches, that was the sort of, that broke the sort of, oh God, I don't think I can do this. And then realizing that it, you know, even if it was rubbish, it was still worth doing to put something out there. Because I think there's a big difference, isn't there, between a leaflet written by a committee, you know, and they're fabulous healthcare professionals, but when you've got something written within a family narrative, so all of the families in the book, we all have different stories, obviously. So you can, and if you don't like the sound of me, you can just jump to one of the other ones. So you get a different, the information is within a story, you know. It's not, I remember reading one of them, and it's put out by one of the cancer charities, I now can't remember, and it was symptoms to expect at end of life. And of course it was the most horrendous leaflet of all the symptoms you might have. And of course you're not going to have most of those. So I ended up, even though I did signpost parents to it in the book, but I said, you know what, really, don't bother reading it. Just ask your medical team what your child is probably going to have to deal with, and then ask them how that would be best managed. And what was funny was this pediatric palliative consultant who helped with the book, she checked everything, because I was paranoid about putting something wrong, you know. And she said, oh, we're so comfortable having that sort of conversation, you know. What are the symptoms? What can you do? And they're like, oh yeah, we can do that. Do you know what I mean? So, yeah. So no, it was cathartic though. It was, if I look back.
What would be your key messages to a parent or carer going through a similar situation to yourself? You know, diagnosis, treatment, end of life.
It's an interesting one, isn't it? As in, actually, so, you know, the book was called Follow the Child for a good reason. You think you can't do it. The immediate thing is, I can't do that. I don't want to do it. I can't do it. Like sort of thinking I can't climb a mountain. It's just this vast, huge, immobile thing in front of you. You don't know how to break that down into just little steps. You're not going to climb the mountain just in one day, you know. And that thing, because I had another mother who lost her son to the same cancer as Dee Dee about 3 years before. And I remember thinking, her talking about it, and I remember thinking, if she can do it in the middle of the countryside, and she's no more a medical professional than I can do it. And I know that there's that thing of saying, you can do it. And it's just have courage to face the things that you're worrying about. And I remember what it took me to say to that palliative care nurse at home when we were doing the advanced care plan, I'm really worried. I don't understand this seizure medication. How does it work? What do I do? But making myself kind of overcome the initial, you know, I just can't speak. Do you know what I mean? And once I'd started, then I'm like, okay, and I'm now worried about this. I'm really scared that they're going to take him to hospital. He does not want to be in hospital under any circumstances. How do we sort that out? She's like, oh, that's fine. We just sign this and we flag it out with on the e-thing system. And then all the ambulances know they're just coming to support you if you have a problem, but until we get other people there. But, you know, it's like, oh my God, it was such a relief. So it's like, you can do it. Palliative care is what, for me, enabled Dee Dee to have, we just were having a normal family life, extraordinary circumstances, yes. You know, they enabled that to happen for all those last 3 months. You know, I'm not saying that all of it was easy, because some of it was incredibly hard, but we had some brilliant times as well. We were doing so much. He was on tons of medication. So basically, it enabled him to live well, absolutely, as long as possible. So he was actually only in bed for 4 days. I mean, that's incredible. Incredible. So it's like, you can do it.
And why do you think it's important to be a palliative care advocate?
Well, you and I were saying this earlier, weren't we? I worried with the book that by talking about services that I know are not everywhere in this country, they should be everywhere. It should be planned and funded regardless of where you live. So based on the needs of the young person, child. And I know it's not everyone. I was worrying that by saying that then it would making it worse. And then I heard a very incredible mum in America talking about this, and she had the same worries and been talking to this very highly placed medical professional who's also in politics. And this professional said to her, and it's been a huge comment, he said, you have to create the demand. If we don't say what we need, they don't think it needs to be there. And because it's so hard for us to talk about, they've just not realized we're here. You know, 50,000 of us, you know, needing properly joined up resources, you know, join them up. It's completely mad. And the thing I'm most worried about and I'm most talking about at the moment is the chronic staff shortage, the specialized children's nurses and the lack of pediatric palliative consultants. To my mind, it is unethical not to have that kind of specialist in any acute hospital where they have an acute unit for children or young people in anything, whether it's oncology or it doesn't matter. They must have them, and they don't in many places. And I have met some, they don't even get a holiday. They are taking calls from families like mine, even on holiday, because there's not enough backup. That is just wrong. So it doesn't matter. We need more money, obviously, because the demand's gone up double in a decade, and in real terms, the funding's gone down per child about 16%. So, but even if we get that money, which we will, I'm quite determined we will get it, you know, if we don't have the specialised staff, it's useless. So for me, the staff is everything. The teams are everything that work with us. So I have to speak.
And I feel the same, you know, feel that sense of responsibility to keep shouting for the rooftop, banging that drum, you know, until things are changed.
Absolutely right. Rock on. I will man those barricades with you.
Yeah. So thank you so much, Sacha, for doing this episode. It's been fantastic speaking with you and so insightful hearing your story. And this is the end of another Palliative Care Talks episode. Really, really great episode. I've really enjoyed doing it. And I hope everyone's enjoying the web series. Like, comment, share, you know, join in. You know, you're more than welcome to. And we'll hope to see you next time. Thank you.
Brilliant. Lovely to talk to you. Bye.